Very warm welcome to Dr. Nadine Nehme, who's also a judge at Innovate this year. Thank you so much for joining us today.
It's my pleasure. Thank you very much for the invite.
So, Dr. Nadine, I would just like to start the conversation by speaking a little bit about Innovate and how key it is to support the SME ecosystem within healthcare.
Well, you start with a key question for, I think, all the healthcare ecosystem and beyond that. Innovation or disruption, as they call it nowadays, is happening everywhere. Innovation is happening at all levels, and it is the key driver for the future. If we do not embrace it, if we do not understand it, if we do not know what are the steps that we need to take in order to incorporate it within our work, I mean, the train will just leave, right? So when it comes to SMEs, most of the SMEs or all the SMEs actually are born because they have an innovative idea. They are born because they have something that they believe will change this world. It can change it massively, it can change it minimally, but at least they have an impact. They do have this change. SMEs, startups, you can call them whatever you want to call them, they need support because as brilliant as these people are and as brilliant as these teams can be, as resilient as they are, they still need support, mostly financial, because when you have a new idea, when you have like a prototype that you want to build and something that you want to try on, you need support. I mean, this doesn't mean that this is going to be like easy happening. If you need support, you need to work properly towards it. They have to define their idea properly. They have to show what this can, like, how can it change? They need to also state where they are different, whom are their competitors. Do not think that you don't have any competitors. You really need to study the ecosystem that you are in. You need to study the landscape. You need to understand where you will make this impact. And then when they approach investors with a properly segmented deck, properly argumented, and they can prove that with this amount of money, they can build a prototype to make their case, most of the investors will support them.
Absolutely. And just to delve into the genesis of Medicus AI and how the need of creating a digital solution that supports the diagnostic industry was recognized. And can you also speak about your role as a chief science officer?
Sure. So Medicus started from a very simple idea. Baher, the CEO, my co-founder, and myself, we come from this medical background, medical healthcare background. Baher's background is a dentist, even though he did not work with this, but he has been an entrepreneur ever since. And I came from academia. I have a PhD and a PhD in genetics and immunology, and I did also a postdoc in gene therapy. So we also come from a medical background. Both our families, both our friends always approach us with a medical report that contains letters and numbers and sometimes small stars or red colors, and they absolutely don't know what this talks about, but they go to Dr. Google, they type it in, and somehow there's always a cancer in the answer. So they call you freaking out and they ask, like, what is this? Why do I have this? And most of the time, like more than 90% of the time, these very small changes are not even changes. These are benign fluctuations that we have us as humans. And you try, like, you talk to your family, you talk to your friends, and then you can start seeing the need for this. Actually, the primary idea that where Medicus was built on came from a publication, an article in Wired, where they were saying that these medical reports have not been touched since 1960. And if you look at us, we were in 2015, and we just couldn't believe this information. And over 70% of your doctor's clinical judgment when it comes to your health is based on these numbers. So if we do not understand these numbers, if we do not understand what they stand for, if we do not understand how we as layman can work on them in order to improve them, there's a huge gap in the system. And this is how Medicus started. So it started with the will of making, like, it's democratizing healthcare, making everyone understand their health data, because this is our right. This is not something that we are actually like wishing for. No, this is my right. This is my data. These are my values. This is my body. This is my health, and I am entitled to understand everything in it. Our problem, in my opinion, our biggest problem is that the current healthcare system is not a health system. It's an ailment system. So it's only when you are sick that you go to the doctor, where it shouldn't be this way. You need to know how to keep yourself healthy, and what we usually lack is the prevention side. And prevention plays a huge role in how we can actually minimize the healthcare cost. We can minimize our ailment. We can at least live longer, healthier, happier, with a proper well-being. So this a bit summarizes how we came to Medicus. I met Bahir in 2015. We discussed the idea. It directly clicked because I have been going through this, and just a personal thing. Like I was at the lab, and I knew that my work was touching a lot of kids' lives, because I was working on severe combined immunological diseases. So these are babies who are born without a proper immune system. So when you work on this, you see the importance of science and medicine and their evolution to support the health of these kids. But then your impact is the impact that this work has is only restrained to the lab. And then I went to be an assistant professor at the university. And this is where I was able to reach out to more and more youth and to explain how important our health is to us. But I genuinely believe that this is not enough. Without technology, you don't have the proper outreach. Without the proper technology, you cannot, like, whom I want to reach, I want to reach out to each and every person outside, be it your mom, my brothers, your siblings. I mean, all of us, we need to understand, independent of our age, independent of the generations, independent of our gender, of our race, we need to understand what's going on with our health. So this is how Medicus started. Um, Due to my background, this is what brought me to be the chief science officer at Medicus. So I'm the brain behind the platforms or the products that we offer on our platform. I make sure that whatever we are offering is scientifically and medically accurate, that it follows the medical guidelines, the medical sciences, that it has been reviewed by our medical doctors. We have 12 medical doctors on board who take care of reviewing all of this information that we present to users and to doctors. We have a very strict validation protocol, and we are an open book to everyone. So whenever you have this information within our products, you will always see the links where we took these from. So we also embed the links in our products, so you as a user can learn more, because knowledge is for everyone. It shouldn't be restrained to only my healthcare professional. They are the experts, but we also need to be knowledgeable.
Absolutely. And as you touched upon earlier, healthcare should be universal for everyone. And just to circle back on a point you made about the products and the range of products that Medicus AI offers, there is smart well-being, smart reports, and safely. Can you tell us more about this and how they support healthcare and client needs?
Sure. So everything started with smart reports. Smart reports, if you want, it's like the heart of Medicus, because it is based on answering the need we just talked about. So you as a healthcare provider, mostly you are a lab or a hospital, you will install the smart reports engine on your servers, and this will allow you to, instead of deliver to your patients a paper with letters and numbers, you will be providing them with a augmented report that shows you a color scale, that tells you exactly where you are, and that provides you with an interpretation of what does this test mean. So no more Google for the time being. It also gives you a few insights and recommendations on what you can do to maintain a healthy life, and what you can do to actually, for example, if you have a value within the borderline, let's say a range, how you can work with like just maybe a few changes of your lifestyle in order to achieve this. So this is a product that we offer for clinics, for hospitals, for mostly labs, and they can provide it. Then we white label these solutions to most our clients, and they can offer it to their patients. This is already available in practically all over the world, and mostly in Europe, in MENA region, in the Gulf, and also in China and Hong Kong. So we do have several languages, like we cover at least 6 main languages. We tailor the product to fit to the needs of the healthcare provider, of the labs. And we also, like in parallel to what we offer to the patients, we do offer a specific lab report to the doctor as well. So the experience is completely tailored to both of them. Once we started with smart reports, we saw that, okay, you as a user will use it when you need it, when you have a blood test and you want to understand what's going on. But how do we keep you engaged with your health? How do we keep you following up on your health in order for you to be able to maintain this healthy state? We then thought of smart well-being. The smart well-being can be seen as a continuity of smart reports, where you actually go take a quiz. It's a very engaging and easy to go through quiz. You answer a few questions, and then you're gonna have some what we call coaching programs. These coaching programs, you're first gonna see your score. So you will be having a physical score, a psychological score. You will know where you stand, and then you will have a few tips. But most importantly, you will have the needed coaching programs that will help you to either improve your lifestyle, to improve your diet, and to improve your sleep. So whatever you answered, because we cover 42 different aspects of our life, and it depends on how did you score in each one of them. So what did you answer, that you will have these tailored coaching programs. You can engage with the coaching programs. The more you engage with them, the more you will see your score shifting. So all of this is to engage each and every one of us in maintaining a healthy lifestyle, a healthy life, and to be able to be in good health. Then with this came the pandemic. So we wanted to offer a solution that is practically, it's a technical solution that helps healthcare providers in managing the pandemic. What this means is that we provide the whole technical system, or the technical management of the patient journey when they arrive to a testing center. They scan a QR code. This QR code will be linked to their own swab. In this case, it's mostly, like right now, it's being used for the rapid tests, for the PCRs, and for the new types of the latest rapid PCRs as well. So it's a management flow that ensures that each and every patient receives their information seamlessly, and that the healthcare provider doesn't have to build this technical infrastructure on their own. So we do accompany them, and then we deliver this information to the user, so the user can know if they are positive, if they are negative, what are the next steps. And this information, depending on the countries as well, can go up to the healthcare providers, because they need to tell the patients to isolate or not. So these are the 3 already available on the market. We do have a latest addition. It's called HomeWell. HomeWell, if you want, is the link between all of these, because HomeWell allows you as a user to either pick a package that, like a test package. Like, let's say you're a healthy female, you want to know, for example, if you have any risks of developing diabetes. Let's say you want to know where do you stand on this, so you can order a package. You can also upload a prescription, and you can take a it's not a symptom checker, it's a conversation that you will have with a chatbot, that where you will tell them what are your main complaints, and it will guide you into providing you what are the tests that you need to do before you go see your doctor. This is a primary experience where the outcome of it is actually you ordering or you requesting a nurse to come to your home, to your office, and then the nurse comes, she withdraws the blood sample goes to the lab analyzes it, they send it to your doctor checks it, and then you have the feedback again. And this is linked also to teleconsultation. So this latest product has been already deployed. It's operational in Egypt. soon in Saudi, and also it's operational in Hong Kong.
It sounds absolutely fantastic and has such a great element of personalization in it, which is so key more now than ever.
Absolutely.
I think it brings me to my next question, which is with digital health coming into play, consumerization and personalization in healthcare are also gaining some prominence and are being very heavily discussed, as we just spoke about right now. So, what are your thoughts, and can you elaborate a little bit more on this?
On the personalization.
On personalization and consumerization, these two elements.
So we are moving bit by bit away from a holistic approach that fits everyone to a way more specific approach that only actually works for you or for someone with who shares with you a lot of these traits. Um, this is this is where things get more interesting and more complicated at the same time. When we talk about personalized medicine or personalized approach, we have to take into consideration all the factors that make you a whole. We like right now you have to see that like lately we wrote an article about patient empowerment. And what's very important for me in this article was the fact that if you only empower your patient, or if you have a patient that you are willing to empower, you will be gaining way more on the personalization level of the treatment for this patient, because when you know your patient, you know what to treat, like how to treat them. You know, a lot of time when you go to the doctor, they might ask you, like, tell me a little bit about your daily lifestyle. Why do they do this? Because instead, for example, of prescribing 2 pills, one in the morning, one at night, he might know that you are a very busy person in the morning and will only prescribe to you 1 pill that has a 24-hour action because at night you have more time to yourself. Even this very small example of personalization is very important because it will determine your adherence to a treatment. It will determine how invested you will be in your health in order to take this pill and to know that this is good for you. So personalization starts at the basic level. It can get more and more complicated right now. For example, we can talk about what medication they are prescribing. Then we can talk about how does this information affect you. Then we can talk about your genetical components or how your genes, like, because right now a treatment for you might be working properly. If I take it, it will not work just because we have different genes and I will be having a different response to this medication than you are having. So here we go into personalized treatments. Then we go to even sometimes this is being pushed a bit too far, in my opinion, because I can see that a lot of this genetical assessments that they call today, where they tell you that we're going to sequence your genome and tell you what's in it. This is not feasible today. This is not very accurate. It's more on the marketing stunts side. But yeah, the more we want to personalize, the more information we need to know. Right now, the best thing that we have is that we and other startups are bridging the gap between the lifestyle data and the medical data. Like from my watch, I have a lot of data. I have my heart rate that is being monitored. I have my exercise regimen that is being monitored. I have my steps, but all of this has an impact as well on my well-being. And if it has an impact on my well-being, it also has an impact on my life, on my health. Right? So what we try to do as Medicus is that we also take, like, we are connected to most of these variables and we take this information into consideration when you are doing your well-being. And we make sure that this is also integrated within your score because you are already doing a lot of things and the data is there. We just need to make use of the data. As you said before, you said something very important. So a lot of things depend on what you put in. So what information you put in within your engines, within your products, also affects what you give out. And if you have the proper information that is coming in, if you have the proper way of analyzing it, you will be only augmenting the personalization of the outcome. You will be providing the proper information that your user need to have in order for them to be treated properly, to follow a proper lifestyle, and to maybe never needing to be treated using, let's say, medication. And this brings us to point number one. Most of the time, we don't know what's going on until we are really sick and we go to see the doctor, where our lifestyle interventions are not enough anymore, and this is where we need to switch to treatments.
Absolutely. And just as you had mentioned earlier as well about, Google Doctor and these kind of ways that, lots of patients go online, they look up for information, and that can also cause a lot of misinformation because the web is a huge pool of information and different forums. And just to, as you said, creating a solution which can actually help them decipher what their results mean is so, so key. And just on that note, I would like to also ask you about, how digital solutions can support sustainable measures within healthcare as well. We spoke about teleconsults and, these kind of methods. How are they really supporting sustainable measures within healthcare?
Well, I think we need to properly define what is a sustainable measure. Is it a sustainable measure where I drive the economic or the financial side of healthcare down and I minimize the expenses? It might help. It might help, but to be honest, or at least what I believe in, is that it's not teleconsultation that will lower the expenses on the healthcare front. It is not. It is not the rapid testing that will lower it. It's the health literacy. If you empower patients, if your patient know what's going on, if your patient is a partner in the medical decision that you are taking, because you are treating me as a healthcare provider, but I do have the right to understand what's going on, and I do have the right to understand what should be done from my side as well to be able to help myself, then this is the only time where I will adhere to my treatment. And if I adhere to my treatment, or if I adhere to my regimen, this will impact positively the outcome, because this will minimize the cost. If we go into a prevention mode, and if we do the proper screenings, if we take into consideration your risks and my health risks, and if I know about them in advance, and for example, if I know that my family is prone to a cardiovascular disease, and I understand this, and this means that less smoking, less maybe substance taking, less drinking, more on the exercising side, less on the fatty, non-good fatty food. Okay, just not to label things wrongly. And then if I know this, I would be actually helping the healthcare system to be way more sustainable. Why? Because I will not be needing these practically monthly visits to my doctor. I wouldn't maybe needing in the short term a stunt in my heart. All of this drives the economy, and all of this is also linked somehow to how we see this healthcare system. Some people see it as a machine where they can make a lot of profit. Other people see it as a very ethical, if you want, approach to help people with their life. There's always a balance in between. And if we want to have a sustainable system, we need to think of all the players. We need to think of the user, of the patient. We need to think of the doctor. We need to think of the nurse. We need to think of the insurer. We need to think of the payer. And we need to make sure that all of this is homogeneous in a way that benefits mostly the patient, but because they are the ones who are concerned, but also that keeps being equally important and interesting for the rest of these players.
Absolutely. And do you feel that now healthcare is more driven by the patient and what the patient wants? Do you have any thoughts on this kind of comment? Because just circling back to consumerization as well, it's very patient driven about what the patient wants and the patient's demands are.
Absolutely. I can see a lot of like difference is being made day by day. Changes are being made day by day. You can see right now that people or patients are way more connected. They will check this information. Right now, if they check an article on Google and they find another one giving some another insight, they will ask their doctor. Doctors don't like that much, like, when you go to the doctor with already pre-assumptions that I have a cancer, just find where it is, your doctor is not happy. But if you go to your doctor and you tell him, okay, well, I read about this and I read about this and I read about this and I need your help to make sense of all of this. Absolutely. Right now, one of the best benefits of digitization is that it is automating steps that the doctor can do in order to liberate their time for them to spend this time with you. And this is amazing because if we automate, and this is what we try to do at Medicus, by the way, and this is all our products aim for this, we want to liberate the doctors and the healthcare providers from any step that can be automated and that takes from their time in order for them to have this extra 5 minutes or extra 10 minutes to talk with you about your concerns. When they talk with you about your concern and when they talk to you about what you are feeling and how do you think you can manage this maybe ailment, this is where it becomes more and more interesting for you as a patient because you will know that you are at the center of this. And this brings you back to personalization, and this brings you back to like to the heart of all of this, who is the patient.
Thank you so much, Dr. Nadine, again for this insightful conversation. We are truly in a very exciting time, and we are so excited to have you as a judge on Innovate.
Thank you very much for having me. It has really been a pleasure. This chit chat was very interesting for me as well, and looking forward to seeing you next week.
Absolutely.
Talk soon.